mean, if you're getting a persistent headache and you haven't been able to tie it to a particular activity, I mean, diagnostically from the kind of vision headaches we're looking for, quite often it's tied to the kind of tasks you're doing. It might be more middle of the day, end of the day, if it's related to work, study, those sorts of things. But any headache that sort of persists and keeps going, you need to kind of think about getting some medical attention to that. And optometry has a role, even if it's not a vision headache, for helping rule out any sort of signs of, the more serious pathological reasons, reasons for a headache. We can look inside the eye, make sure the optic nerve looks fine. Depending on the presentation, we can look at a visual field test to make sure that there's been no visual field loss. That might indicate something sort of more serious. So we have a role to play there, particularly if you start adding in waking up the headaches, if you're getting nausea, if you're getting dizziness. I mean, that starts to escalate. You really need to be getting medical attention when you start adding those other symptoms into it. And so there's that place. But if you've been through the sort of process of having it medically diagnosed and you're still getting these sort of headaches and you haven't had an eye exam, then that's a good place to start, because it may well be that it's a vision problem, whether it just be, sometimes a minor prescription problem can create headaches in some situations. It might be we're looking for dry eye, might create headaches in some situations. I certainly have experienced that myself, where I've gone through periods of having dry eye, and if you're trying to keep working through it, is it the blur that the dry eye causes? Is it just the discomfort, and therefore over time you get a headache from just the strain of the discomfort? Is it the brow ache that you're getting from trying to peer and keep going with the work despite the dry eye? And you have similar sort of behaviours when you're doing when you get headaches from eye strain from binocular visual dysfunction. It could be that you're just doing a lot of near work and eventually your eyes get tired and strained and then you get a headache. And so tension sort of involves all of these things. So what we would have a look at is, do you have a sight problem? Do you have a binocular vision or accommodation problem that matches the kind of headache and the timing of the headache you're getting? And then we do all the health checks as well to rule out anything more sinister, which are rare, but the consequences can be quite high. And so that's where we want to be sort of alert enough to sort of seek care, but don't worry until you get it, kind of thing, unless you're getting those other, like I said, nausea, vertigo, more serious kind of roll-on symptoms that are going along with it.